supply of essential medicines is a key element of an effective health system. Reliance on the market alone to supply medicines for the poor people will not work. There is need to increase poor people's access to affordable essential medicines by improving transparency and accountability within the marketplace. That is what META is all about. In 2002, there were nearly 6 million deaths from HIV and AIDS, tuberculosis and malaria. An estimated 2 million children in developing countries died from prenatal conditions, and 4 million died from just 3 diseases: pneumonia, measles, and diarrhea. Heart disease, stroke, cancer, and chronic diseases are rising in low-income countries, yet medicines exist for nearly all of these health problems. By 2015, an estimated 10.5 million lives could be saved every year by expanding access to existing intervention for infectious diseases, maternal and child and non-communicable diseases. This indicates why access to essential medicines is so important. Access to essential medicines has made a difference in so many ways. The number of deaths from measles has fallen 60% since 1990. Access to drug treatment has transformed AIDS into a potentially manageable chronic illness. My friends from NAPLAS can confirm this. Essential medicines really save lives, reduce suffering and improve health, but only if they are of good quality and safe, available, affordable, and properly used. In Ghana, there is no sufficient data to suggest that these conditions are being met. Essential medicines are different from other consumer products and require special attention, in that the consumer often does not choose the medicine. It is prescribed by a clinician or recommended by a pharmacist. Even when the consumer chooses the medicine, he or she is not trained to judge its appropriateness, safety, quality, or value for money. The consumer often cannot judge the likely consequences of obtaining a needed medicine. So policies and actions have to be proposed to address these challenges with the purpose of making essential medicines more accessible. Some examples. Prescribing a new expensive treatment, despite the availability of proven cheaper alternatives, is not cost effective and wastes the scarce resources of government and patients. There is clearly a conflict of interest. This one well noted. When doctors, in quotes, both prescribe and dispense at the same time. We can discuss that later. It is the patient who pays the price when profit comes before ethics. Improvements in efficiency of procurement and local manufacturing of medicines to obtain the lowest possible prices for products of assured quality should be an urgent priority. Transparency in price information is lacking. It is vital that patients are informed of current prices, for instance, through regular publication in newspapers, so they know what is acceptable price and know when to buy when entering the pharmacy. Ghana, being a META country, has committed to working with civil society in promoting access to affordable medicine. There's a lot to be done by civil society to represent the needs of the poor and in promoting social justice. And this includes to monitor health outcomes in Ghana, to ensure the public understands information on medicine's quality, availability and price, to help inform public debate, to disseminate information and encourage community engagement on health outcome through the media, community meetings, and any means possible. It is against this background that civil society organizations interested in access to medicines, governance, transparency, and accountability processes are attending this national capacity building workshop. The workshop is part of civil society capacity strengthening work of the International Medicine Transparency Alliance. It aims to use multi-stakeholder approach towards increasing transparency around the regulation, selection, procurement, sale, distribution, and use of medicines in developing countries, thereby strengthening governance, encouraging responsible business practices, and ultimately improving access to medicines, especially for the poor. The meaningful participation of civil society in these multi-stakeholder activities in Ghana is critical to the success of the process. This 5-day workshop will help participants, 1, feel more prepared and comfortable to engage with national policy processes, acquire knowledge or specific knowledge on issues related to medicines, in particular transparency, accountability, and efficiency issues, acquire skills to promote greater transparency and accountability at national, district, and community levels, strengthen network and establish linkages among CSOs working on essential medicines issues, and develop ideas on development, experience sharing, and some zonal planning sessions each day, organized for selected civil society organizations based in Ghana, Uganda, and Zambia in February 2008.